Welcome, everyone. This is Pat Halpin-Murphy. I'm president and founder of the Pennsylvania Breast Cancer Coalition. And I'd like to welcome all of you to the second of the Pennsylvania Breast Cancer Coalition's series of webinars. I hope you've all had a wonderful Thanksgiving holiday, and I'm thrilled that you're participating in this very exciting opportunity to get excellent information about the Affordable Care Act.
We have the wonderful Joanne Grossi joining us this evening. She is the Region 3 Director for the Department of Health and Human Services with the U.S. Department of Health. She's been wonderful to do this program for us many times. We appreciate all of her help in bringing this information to people who need it. So with no further ado, I'm going to go ahead and give control to Joanne.
So thanks, everyone. It's my pleasure to be with you tonight to tell you about the health insurance marketplace, give you some information on the Affordable Care Act, and then also speak to you about Medicaid expansion, which is happening in Pennsylvania. So first and foremost, just wanted to, you can see on this first slide, even though we got off to a rocky start last year, we ended up exceeding our goals in terms of enrollment. You can see that we ended up with 6.7 million people who signed up for health insurance through the marketplace. That's 6.7 million who signed up and paid for their premiums. Another 3.1 million young adults who gained coverage thanks to one of the provisions in the Affordable Care Act, and then another 9.1 million who actually ended up qualifying for Medicaid and CHIP. So as a result of that, we were at the start of open enrollment, the uninsured rate in the country was around 18%. It dropped down to 13.4% thanks to this first open enrollment period. And just as importantly, we do think part of the goal of the Affordable Care Act is to bend down the cost curve. And you can see that again before open enrollment started, the gross domestic product rate in this country on healthcare was about 18%. And it dropped down to 17.2%. So, meeting both of our goals of getting more people health insurance and also, reducing the amount of money we spend on healthcare in this country. So next slide, Erica. So let me just tell you a couple of the major provisions of the Affordable Care Act, and please remember that as of January 1st of this year, all these provisions took effect. So I mentioned this a moment ago, but what became true actually in September 2011, young adults up to the age of 26 can now stay on their parents' health insurance. And as I mentioned, 3.1 million young adults benefited from this provision, including 95,000 here in the Commonwealth of Pennsylvania. So a really important provision. Secondly, contrary to what you heard, we actually strengthened Medicare thanks to the Affordable Care Act. And I could spend a lot of time on this, but the two important provisions I want to make sure you know about, that what became true January 1st, 2011, from now on, anyone on Medicare gets free preventive services, things like mammograms, colonoscopies, PSA tests, Pap tests, flu shots. Those are all free for you now on Medicare. There's no out-of-pocket costs, no co-pays, no deductibles. And secondly, which we think is just as important, anybody who knows about the Medicare Part D prescription drug program, there's historically been this gap in coverage where beneficiaries paid 100% of the cost. That's known as the donut hole, and we're completely closing the donut hole by the year 2020. In the interim, we've put some discount formularies in place. So, for example, what became true January 1st of 2014, if you hit the donut hole, you get a 53% discount on brand name drugs, a 28% discount on generic drugs. And again, that discount formula is going to keep going up every year until the year 2020 when we completely close the hole. And to date, we've had over 11 million seniors benefit from this provision, saving $8.9 billion. So again, a benefit working exactly the way we hoped it would. Third, lifetime limits on care, went away for people as of January 1st of this year. And in the past, insurance companies generally had about $1 million limit on your benefits. So again, lifetime limits on care went away. Annual limits on care has gone away. And then also in the past, if you got sick, your health insurance company would look to see if you didn't fill out an application right or didn't sign something correctly, and they would take your coverage away from you. But it's also become illegal now for insurance companies to rescind your coverage when you get sick. So next slide, Erica. Also next, just to tell you quickly about some changes we made to insurance company practices. I've got nothing against insurance companies. My sister's a senior staff person at Independence Blue Cross, but we did think there were some changes that needed to be made. The one I want to make sure you're aware of something we call the 80-20 rule, which took effect in September 2011. From now on, insurance companies must spend 80% of your premium dollars on your medical services. It can't be for bonuses to CEOs or trips to the Bahamas. It actually has to be on your medical care. And in the summer of 2012, they had to start reporting to us at HHS that they were adhering to this formula. And if not, they had to give consumers a rebate. And in fact, in the last 2 summers, consumers have received over $2.1 billion in rebates. So again, a provision working exactly the way we hoped it would. And the last provision I think is that I want you to know about, which I actually think is the most important one. From now on, no one can be denied health insurance for having a pre-existing condition, and just as importantly, can't be charged more for their health insurance for having a pre-existing condition. And obviously, there's a very long list of what insurance companies used to consider pre-existing conditions, but certainly being a cancer survivor is one of them, or having diabetes or hypertension or arthritis. There was a very long list in the hundreds of conditions of why insurance companies would consider you to have a pre-existing condition. And so I guarantee you everybody listening in on this call either has a pre-existing condition or loves somebody who does. We actually estimate that 47% of Americans have a pre-existing condition. So again, to me, this is really, as the aunt of a niece who has multiple sclerosis, I guarantee you I think this is one of the most important provisions in the law. And finally, we think we're making health insurance more affordable for middle-class families and small businesses with the creation of that health insurance marketplace. So I will tell you about that now quickly. So next slide, Erica. So states got to make a decision on how they wanted to run the marketplace in their state. If they wanted to run it themselves, it would be called a state-based marketplace. Your neighbor states of New York and Maryland made that decision. If they said, we'll run part of it, you run the other part of it for us, it's a federal-state partnership. Your neighbor states of West Virginia and Delaware decided to do that. Or they could say, they could have said, we don't want to run it at all, you run it for us. And in that case, it's called a federally facilitated marketplace, and we at HHS then are running the marketplace for you. And under Governor Corbett, he made that decision not to run the marketplace, so we at HHS are running the marketplace for you here in Pennsylvania. Next slide, Erica. So as I said a minute ago, Pennsylvania is a federally facilitated marketplace, so again, we're running the marketplace for you here. On October 1st of 2013, when the marketplace opened, we had estimated that there's about 1.3 million uninsured in Pennsylvania, and of those, about 600,000 were eligible to enroll in the marketplace, with the other 600,000 or so eligible for Medicaid if the state decided to expand Medicaid. After the first open enrollment period, we had over 318,000 Pennsylvanians who enrolled in the marketplace, so you know, more than half actually got insurance who were eligible through the marketplace the first time, exceeding our goals. And then we like to say that there's no wrong door. So some people went to apply for the marketplace but ended up qualifying for Medicaid. So we had another 41,000 who were able to enroll in Medicaid. So for a total of, you know, over 360,000 Pennsylvanians who got health insurance through this first open enrollment period. And again, exceeding our goals. So next slide, Erica. So now I actually want to tell you a little bit about the nuts and bolts of the marketplace. And I have to remind you, this is private health insurance that people are going to be applying for in the marketplace. And I'll talk a little bit more about that in a minute. But it's important to remember, again, this is private health insurance. And so you see this slide with actuarial values next to it and the metal levels of bronze, silver, gold, and platinum. And so those percentages next to it, for example, with the bronze plan, means that the plan will cover 60% of the cost of your care, and you're responsible for the other 40%. You can imagine that's going to have a very low premium, but very high copays and deductibles, which is something I'll talk about more in a minute, but that's really important to remember when you're making these choices. I tell people all the time when they go in the marketplace, they really have to think about where they are in terms of their financial situation and their personal health, because you know, a bronze plan again is going to have a low premium, which is great if you don't earn a lot of money, but if you get sick, you're really taking a chance because you're going to have lots of high copays and deductibles. So it's really important to know these differences here. So you see those actuarial values go up to the platinum, which equals 90% actuarial value. So again, that means the plan is going to cover 90% of the benefits. You're responsible for the other 10%. So that's going to have a high premium, very low copays and deductibles, if any at all. So if you're a 55-year-old cancer survivor, you know, the platinum plan is something that probably looks good to you, but again, remember it is a high premium. If you're a 28-year-old healthy guy, you know, the bronze plan probably looks good to you. But again, I really have to stress the importance of knowing that, you know, if you pick a bronze plan, you have very high copays and deductibles, so you're really taking a chance if anything catastrophic happens to you. Next slide, Erica. So someone's going to say to me, well, I'm a 55-year-old cancer survivor, so I love that platinum plan, but I can't afford it. So the law thought of that as well. So as you can see on this slide, if you make between 100% and up to 400% of the federal poverty level, and as you can see, 400% of the federal poverty level is about $47,000 a year for an individual, about $95,000 a year for a family of four. You actually get financial assistance from the federal government to help pay for your premiums. You will know that math right up front. If you apply on healthcare.gov, which I'll talk about more in a minute, which we certainly encourage, you put in, answer some questions and put in information about your income, and you will know the math right up front of what you would qualify for in terms of financial assistance. And this math is very important. This will help you decide which of those metal plans you want to purchase, and then within the metals, what plan you actually want to purchase. So again, that information is going to be really helpful to you to make a decision on what plan works best for you. Next slide, Erica. So in addition to that, if you make up to 250% of the federal poverty level, and as you can see on the slide, that's about $29,000 a year for an individual, about $60,000 a year for a family of four, you get additional financial assistance from the federal government to pay for your co-pays and your deductibles. The caveat to that is you must pick the silver plan. And in fact, last year most people did pick a silver plan. That was the majority plan that people picked in the country and in Pennsylvania. And additionally, I should tell you that about 81% of Pennsylvanians did receive financial assistance last year in the marketplace. So the very vast majority of people will qualify for the financial assistance to help pay for their premium. So again, you'll know this math right up front when you're applying, so this helps you, pick what plan you want. But again, if you do the cost sharing reduction, you must pick a silver plan. Next slide, Erica. So as I said to you a moment ago, this is private health insurance. We have 15 companies participating in Pennsylvania, and there are companies like Independence Blue Cross and Highmark and Geisinger and Aetna and United Healthcare, et cetera. And in fact, we have an addition this year. United Healthcare was not in the marketplace last year, but it is this year. So again, attesting to the success of the marketplace, that we even had the largest healthcare provider in the country joining the marketplace this year when they hadn't participated last year. You can see that of those 15 companies, Pennsylvania is going to have more than 125 plans to choose from. So it's what we keep trying to say, why we call it the marketplace, that this is competition for your business, and consumers are going to be able to shop, for the plan that works best for them. I mentioned this already. 81% received financial assistance from the federal government last year to pay for their premiums, and 6 out of 10 ended up paying a premium of under $100 a month. So again, we really do believe it's the affordable in the Affordable Care Act. Next slide, please, Erica. So what's also important to remember is that my old boss, Secretary Sebelius, had the statutory authority to decide what had to be in every single plan participating in the marketplace. We call this the essential health benefits. So you can see that list there. It is very comprehensive services, we believe. And if you're any plan participating in the marketplace, bronze, silver, gold, platinum, it doesn't matter. You must provide these essential health benefits. Now this is the floor. A plan can offer more than this, but it cannot offer less. So again, every plan participating in the marketplace must offer these services. Next slide, Erica. So how can you apply? So you can apply in 4 different ways: online at healthcare.gov, which I can't stress enough is the absolute preferred way to apply, because you can apply online and actually in real time find out what your financial assistance will be for you, and then at the end of it hit enroll, and then we'll have enrolled in health insurance in real time. Now, it's important to remember you don't actually have the health insurance until you paid the first premium, but again, in real time you can shop and purchase health insurance. So we really encourage using healthcare.gov, but you can do it by phone, and I'll give you that phone number in a minute. You can print out a hard copy application and mail it in, or you can do it in person. And what we mean by that, which is something I think is really important under the law that it recognizes, is we have a program called Navigators for Certified Application Counselors. These are federally funded folks who have gotten training and been certified by us at HHS that they understand the marketplace and can assist you. And these are folks who will literally sit next to you at a computer, help you navigate the system and the marketplace, and help you enroll in a plan that works for you. By law, they must give you neutral information. They cannot, for example, say that Independence Blue Cross Silver plan looks like the right one for you. That is illegal for them to try to sway your opinion on what plan to enroll in, but they can give you neutral advice on how you literally navigate the system and enroll in it. And as I already mentioned before, we say there's no wrong door. If you go into the marketplace, you can find out if you actually end up qualifying for Medicaid or CHIP, and if you do, those applications get sent to the appropriate state agency. Next slide, Erica. So I mentioned that there's a phone number. We have a toll-free call center. You see that number there, operating 24 hours a day, 7 days a week, 360 days a year. It was closed on Thanksgiving and closed on Christmas during this open enrollment period. In addition to being available always in English and Spanish, there's an additional 240 language lines, so really helping people in any language that they use. And you can see we also have a 24-hour-a-day, 7-day-a-week web chat in English and Spanish. And again, this is very useful if you're trying to apply online and you have some questions. You can use that web chat 24/7, and people will help answer your questions. I already told you about navigators and certified application counselors, but again, can't tell you what a resource they are, and you can find them everywhere. And I'll tell you about that more in a minute. But at community health centers, at libraries, food banks, etc. And of course, we also still see that there's an important role for agents and brokers. Next slide, Erica. So open enrollment began already. It began November 15th. It goes to February 15th, 2015. If you apply by December 15th, your coverage starts January 1st. After that, it does matter what day of the month you apply. So if you apply before the 15th, your coverage starts the first day of the month. Of the next month. If you apply after the 15th, your coverage starts the first day of the second month. So example, anybody who applies December 16th, their coverage won't start till February 1st. Again though, anybody applying by December 15th, their coverage starts January 1st. And of course, even though that's when we have the open enrollment period, we do have what's known as the special enrollment period, and that's for anyone who has a qualifying life event. And that list is very long, which you can find at healthcare.gov, but it's things like if you got married, if you got divorced, if you moved states, if you gained citizenship, if you got released from prison, if you had a baby, if you lost your coverage because you either quit your job or lost your job. So it's actually a very long list of reasons for why you have a qualifying life event. In that case, you can enroll in the marketplace at any time. The special enrollment period means you can apply in the marketplace at any time during the year if you have one of these qualifying life events. Next slide. And so I must finish by talking about Medicaid expansion, because I'm very happy to say that Pennsylvania is finally going to be expanding Medicaid. I mentioned earlier that we estimate about 600,000 Pennsylvanians will be eligible for health insurance with Medicaid expansion. So we're very happy that Pennsylvania has expanded Medicaid. A reminder, it's 100% paid for by the federal government for the first 3 years, 2014 through 2016. Of course, Pennsylvania did not have Medicaid expanded for this year, but at least for 2015 and 2016, we will pick up 100% of the cost. Then the federal funding ticks down to 98%, 97%, et cetera, until the year 2020, when it becomes we cover 90% of the costs. the state covers the other 10%, and it remains that formula going forward. So again, we think this is really beneficial for Pennsylvania, both in terms of morally that Pennsylvanians will have this health coverage, but also fiscally. We estimate in the first 6 years Pennsylvania will receive about $17 billion in federal funding, and create about 35,000 jobs. So we think this is important for both reasons in Pennsylvania. And of course, we approved the Healthy PA proposal. That's what it's being called here in Pennsylvania, Healthy PA. We approved it in August. It actually takes effect January 1st of 2015. But next slide, Erica. The applications actually began yesterday. So applications began for Healthy PA or Medicaid expansion December 1st. And for anyone who does apply this month, their coverage becomes effective January 1st. After that, you actually have your Medicaid coverage whenever you apply. So the date that your application's been accepted is the date your coverage will start going forward. A reminder, though, about what Medicaid expansion means. It means any individual and families with income up to 133% of the federal poverty level are eligible, and 133% of the federal poverty level is about $16,000 a year for an individual, about $32,000 a year for a family of four. So, working poor now in the Commonwealth who are going to get health insurance that they have a right to receive. So we're really, again, happy about what's happening there. Just one thing. Now, of course, the elephant in the room is now with the election of Governor-elect Wolf. He has said he wants to go to pure Medicaid expansion, so some of the components of Healthy PA might change, but just so you know, the way it stands now, there is no cost for anyone for Medicaid in 2015, but the way Healthy PA is outlined now, there will be premiums that individuals will have to pay in 2016. But again, Governor-elect Wolf has said he wants to go to pure Medicaid expansion, so we'll have to see what happens with that. Next slide, please. And finally, here's some resources for you that are really helpful, I hope. Again, I've mentioned it many times, but I can't stress enough how useful healthcare.gov is. It's where you'd apply online and where you can get really most of your, if not all of your questions answered. It's really a great resource that I'm not sure people are aware of, but it's not just to apply. You actually can get lots of information about questions that you want answers to. If you're interested in learning more about Healthy PA or Medicaid expansion in Pennsylvania, of course, please remember it's being run by the state now. Medicaid is run by the state, not by us at HHS. But if you go to the healthypa.com website, you can actually get the link to apply and the phone number, and they also have a list of frequently asked questions. So a really useful site to go to if you're trying to help anyone or learn yourself about Medicaid expansion in Pennsylvania. And then also I mentioned, how we have navigators and certified application counselors. If you go to localhealth.healthcare.gov, you type in your zip code and you'll actually get a list of all the organizations that are available to provide you, again, with free, neutral assistance in applying for health insurance. And finally, you can do the application in Spanish completely at cuidadodesalud.gov. So again, you can do the entire application in Spanish at that website. So that's healthcare.gov in Spanish. I encourage you to go to that if your primary language is Spanish. Last slide, Erica. So finally, I want to thank you for participating on this webinar. That is my personal email address you see there. I am your public servant, and it's my honor and privilege to work for you. So if there's anything I can help you with going forward, I look forward to doing so, and I will take questions now. And if for any reason there's a question I don't know the answer to, I promise you I will get an answer to you. So Erica, I'll turn it over to you for any questions.
Great, thank you so much, Joanne. The first question that came in early, and you did cover it, but I think it bears repeating. The person is asking that she works with people who are uninsured in her town, and she wants to direct them to the right place to get help, and referenced FAN's phone number. If someone is wanting to enroll, maybe doesn't have access to the internet, what do you think is the best place for her to send people who she meets who are uninsured?
Yeah, I think the best one is actually the marketplace phone number, 1-800-318-2596. because no matter where you are in the state, that's going to get you a marketplace representative, and all you have to do is tell them what zip code you're in or where you live, and they can actually give you the phone numbers or connect you to a navigator or certified application counselor. So instead of remembering lots of phone numbers, the best one is just our toll-free call center, which again is also open 24/7, so you don't even have to worry about hours or days of the week or even in the middle of the night if you want to ask, literally, 800-318-2596.
That's wonderful. Great. We have another question that we had gotten in advance, and it's about coverage provisions for essential health benefits, since they vary by state and even between each insurer. So the question was, how can a patient determine whether a policy that they're looking at would cover needed compression garments and things that might treat lymphedema? How do they make sure that will be covered before they enroll?
Yeah, and and I'm going to admit that really is a difficulty. You really are going to have to do a lot of work, and in terms of, so for example, where you live in the state matters. So if you live in this area, I believe there's 4 companies doing the coverage, like Independence Blue Cross and Aetna and United Healthcare. And so, I hate to say it, you'd have to do detective work and really call these companies and ask, do they cover them in the plans? And I understand that that's a lot of research and work. But unfortunately, because you're right, because every single company gets to make decisions about, the additional services, you really have to do kind of your own research and legwork and find out by calling these companies that are participating in your area if they offer that coverage.
All right, thank you. I have another question here from Karen, who is looking for a little bit more clarification on cost-sharing assistance as it relates to the Silver Plan. She says she helped her daughter with this, who made $18,500 and thought that the Bronze was her only affordable option. Could she have gone for the Silver Plan?
$18,500?
Yes.
Is what she made in a year? Oh, yeah, absolutely. That's definitely under 250% of the federal poverty level, so she absolutely could have gone for the Silver Plan. And we are in the open enrollment period now, so this is the time to make that change.
Great. And I have a question about keeping your doctor. Someone's concerned about, will they have to find new healthcare providers?
So there's 2 things I want to say about that. One is actually we've made a change to the health insurance marketplace now, and going forward, insurance companies are going to have to be much more clear when you go on healthcare.gov so that you can see a list of your providers. But in many cases now, they're already listing it. So I'd encourage you to go to healthcare.gov. You don't have to go through the application process to get questions like that answered. There are 2 different icons on the site, and one says compare plans. So you can actually just look at plans and see what's in them without having to do anything about the application process. You literally can just get sent to the plans in your area and take a look at them and see if your provider's in there. And secondly, again, like I mentioned, we are changing the laws now, and in the future, plans are going to have to be very specific about the providers in their plans. And third, I hate to say it, there's still, again, some legwork in it. If you have a doctor you really like, you make a call to him and say, doctor, are you, what plan are you participating in the marketplace? And, I totally realize that this is some work on people's part if they want to make sure that they have certain doctors, but if they don't see them listed, when they're comparing plans or looking at the plans, I really encourage people to make a call to their doctor if they really want to stay with them and find out if they're participating in the marketplace, and if so, in which plans.
Wonderful, thank you. And how about if someone says, I see the financial assistance and all this, but I just can't make it work. They absolutely cannot afford the plans that they're seeing, but also want to avoid any sort of penalty. Is there any other option aside from these metal plans?
Right. So there's 2 things I want to say about that. One, so thank you for bringing it up. It is law now as of January 1st, 2014, that you have health insurance. And so if you did not purchase it, this year, you do get penalized. When you file your income taxes next year, it's $95 per person or 1% of your income, whichever is greater. So that is important to remember. If you fall between 100% And again, I'll just bring it up to you again. 100% of the federal poverty level is a little less than $12,000 a year for an individual, up to 400% of the federal poverty level, which, as I mentioned earlier, $47,000 a year about for an individual. Then you are considered to be able to afford health insurance, and then you'd go into the marketplace again with getting financial assistance. If you feel like you don't, between those guidelines I just gave you, between $12,000 and $47,000 a year for an individual, if you feel like that's still cost prohibitive for you, you can apply for, a hardship exemption. However, and you can find that hardship exemption application right on healthcare.gov. However, though, if you really do fall within those guidelines, it is unlikely you'll be granted the hardship exemption. But you can apply for a hardship exemption, and you can find that form on healthcare.gov. Because don't forget, anyone making below, 100% federal poverty level now will get Medicaid in Pennsylvania. So certainly, last year there was a reason why people, couldn't have afforded the premiums. But again, this year with the financial assistance and with Medicaid expanded, we're hoping it's affordable to most people. But after all that, if you still think it's unaffordable and you're willing to take even the penalty, please remember we do have federally qualified health centers that provide low-cost or free health care to anyone. And again, that's always an option available to anyone.
I have a question here from Kate, who would like to know what counts as income.
You mean, okay, so Kate, sorry, I wish I knew more, but
so if you're saying that their income can be this much percentage of the federal poverty level, what all is counted in that? Is that just their take-home, their pre-tax income? Would investments qualify?
Oh, so and I was saying earlier that you can find out a lot of these answers on healthcare.gov. This actually becomes pretty complicated, so I'd rather not take the time on this. There are things that count and don't count as income, so things like, if you get money from a spouse because you're divorced, or investments. So I actually encourage her to go to healthcare.gov, and you can see that question pretty quickly, and you can get the whole list of what counts and what doesn't count as income. There are certified application counselors and navigators all throughout the state. You can, and of course that marketplace phone number. I mean, you should feel free to call a marketplace representative at any time if you have a question that you think of later. That 1-800-318-2596 number. Again, 24 hours a day, 7 days a week. That's what that call center is there for. So if you didn't think of something now, or for the person who asked about the income question, if you wanted to go over it with a marketplace representative, really encourage you to call that phone number.